Hello, I'm EunRyung from Seoul National University's Fact Check Center. What stands out in the phenomenon of the production and spread of misinformation in Korea this year is the COVID-19. It is difficult to estimate the total amount of misinformation produced about COVID-19. But I think I can make three main points. First, health issues are becoming more politicized. Second is the internationalized distribution of misinformation. Lastly, it was confirmed that cooperation with fact-checkers and platforms is important in deterring misinformation. First, the phenomenon of public information interlocking with political conspiracy theories is notable. Conservatives who oppose the current administration claimed that government is using the COVID-19 quarantine to suppress conservative forces. Let me introduce an example. Recently, there has been a phenomenon in Korea where the spread of corona has increased since the anti-government protests. In response, rumors spread through conservative YouTube, internet communities, and messenger apps that the public health centers manipulate the test results of protesters. The claim was so obviously false. It was fact-checked by 5 media outlets of SNU Fact Check. Notwithstanding, the ecosystem of rumors separated from the mainstream media is increasingly being built, and filter bubbles seem to be taking place. Second, it is the phenomenon of internationalized distribution of misinformation. It is easier to make misinformation cross the border, such as videos and photos. For example, a manipulated photograph has been circulated in Korea. It was known that the victims of COVID-19 in Wuhan who fainted on the street. In real, it was a performance in memory of Holocaust victims in Germany. As automated translation became easier, the translated misinformation were distributed through internet, saying they were published by overseas experts and overseas research institutes. People are better at believing in information that impersonates a professional. Lastly, the coordination of fact-checkers with the platform. SNU Fact Check, which includes 30 media outlets, has checked more than 200 cases related to COVID-19 since the first corona case in Korea as of the end of September. In South Korea, the first wave of infection came in February with a sharp increase in the number of corona patients, mainly in a provincial city. Public anxiety has also heightened. During this period, portal service Neighbor, which Koreans use the most for news consumption, posted a banner on the mobile homepage so that users can see the Corona-19 fact check posted on SNU Fact Check directly. Traffic surged after the banner's posting exceeding 500,000 times a day. What is important to prevent misinformation is to increase the visibility of reliable information. In the case of information at stake in the public, such as COVID-19, it is an example of what role the platform should play. We hope the lessons we learned, what we saw worked and what didn't, can be resourceful information to all of you here today looking to improve fact-checking in your home country. Thank you all.